to the zone.
Welcome to the Zone with your host, Alexon Hortaleza. In this episode, we will be talking about skincare. We've prepared a few questions, we're ready to debunk a few myths, and discuss a skincare routine for you guys. So I'd like to introduce our special guest today. She is Dr. Kate. She is a board certified dermatologist for 5 years. She is the founder and handling Sunday Skin Center here in Santolan Town Plaza, the second floor.
So thank you for that introduction. I'm Dr. Kate Cembrano Mamaklay. I'm a board-certified dermatologist and my subspecialty is in dermatologic surgery and lasers. Today we're here at Sunday Skin. It's on the second floor of Santolan Town Plaza, like what Mr. Alex said. And this is my first clinic outside of the hospital. So I also have other hospital affiliations. I'm affiliated with the St. Luke's Medical Center in Quezon City and also Fatima University Medical Center in Antipolo.
So welcome to the podcast.
Hi.
Kamusta? Is there anything exciting that you want to share?
Actually, very excited to be bringing my daughter to school this week. I have a 22-month-old baby and she's starting to get super excited na about playing with other kids her age and singing and holding mini concerts at home. So it's been quite fun and really tiring with a toddler. But since I'm here at the clinic most of the time, I'm working most days from 10 to 7 so far since we started. I kind of miss her. So I really want to bring her closer to me. So there's a school nearby that I'm going to enroll her in for play school this week.
I can totally relate kasi I just have the newborn son.
Okay.
2-month-old pa lang.
Congratulations.
Thank you. And very exciting nga. Nakakatuwang nakikita ko siya everyday. Tapos paglabas ko
In fairness sa'yo, hindi ka mukhang puyat for within that 3-month period.
Hindi lang mukha, pero
Kasi I remember yung first 3 months talaga was really the toughest, diba? I mean, I'm sure, is this your first or your second baby?
it's my first, yeah.
Okay. So, that first 3 months talaga is the most grueling because you're all adjusting pa with your with your schedules at home and then your new roles sa bahay, diba? Do you wake up in the middle of the night to change diapers now?
Not really. Since I don't know. Pero still, yung involvement na every 2 to 3 hours, nagigising yung babies, parang nagbabago yung schedule.
Mahirap,
diba?
yeah. And it will really change pa in the next year. Very exciting. I'm happy that you're in the parenting club.
Thanks, Doc. Ikaw ba, Doc? Is this your second child?
No, she's my first.
Your first then.
Yeah.
So, wait,
I have a daughter.
22 weeks?
22 months.
22 months.
So she's 1 year and 10 months. 2 months shy of her second birthday.
Okay, congrats then.
Thank you.
Just to start, Doc, what's the difference of a board-certified dermatologist?
So, for one to become a board-certified dermatologist, you have to be able to take the physician licensure exam, right? So, that's more or less about 5.5 years of going through the rigorous training of basic medical education. And then we enter one of the, I think, if I'm not mistaken, about 13 or 14 institutions who have the residency training program under the Philippine Dermatological Society.
Oh, okay.
After which, we take the board exam of dermatology. Usually, it will take about 2 weeks of different types of exams. And then, that's when you are able to call yourself, once you pass that, a board-certified dermatologist.
Marami palang subspecialty yung dermatologist.
Yeah. Actually, marami kasing mga, like I said earlier, diba? Maraming iba-ibang types of skin pathology. So, every dermatologist, most dermatologists who do pursue subspecialties, may specific talaga sila na concern na talagang they really focus on. Like, for example, for me, personally, my subspecialty is dermatologic surgery and lasers. So, I like this field because it has a lot to do with procedural dermatology. I really like doing surgeries when I was in training, no? So, when I was in a medical intern and a medical clerk, gustong-gusto ko yung nag-a-assist sa mga surgery dati sa OR.
Okay.
But, I wasn't fully committed to do yung lagi kang on-call, na laging may emergencies, ganyan. Kasi I wanted to build my own family agad. Sana. That was the hope. But yun, I wanted also to go into OB, for example. Pero
Mhm.
yun nga, hindi rin fit dun sa lifestyle that I had envisioned for myself.
Okay.
So what I like about Derm Surge is you're able to kind of timpla yung type of lifestyle that you want to have. I can be as toxic as I want to be because we deal with also a lot of mga hospital-based referrals like for skin cancers or tumors that need to be taken out. But I can also be kind of, I have that flexibility na pwede akong mag-treat ng just outpatient consults, for example. If yung practice ko naman, like for example, here, mostly mga aesthetic concerns. So, lahat ng mga Botox injections or neurotoxin injections. Botox is a brand that is usually parang may misconception na Botox is the procedure, but it's actually a neurotoxin brand.
It's a brand. Ngayon ko lang
Yeah.
nalaman yun to For
So,
the longest time, parang Botox
yeah,
lang yun.
Botox is So, kaya naman karamihan ng mga marketing stuff nakalagay Botox kasi yun yung nare-recognize ng mga tao. If we say neurotoxin, not a lot of people will understand na it's that procedure.
Okay.
But it's really not, it's not supposed to be said that way. Apart from that, other subspecialties will include also phototherapy, those who deal with a lot of mga chronic eczema, psoriasis, atopic dermatitis. You also have dermatopathology. So if you have your pathologists dealing with mga frozen sections in the hospital, you also have dermatopathologists who read our mga biopsies of the skin. And then we also have mga immunobulos or immunodermatologists who deal with a lot of mga autoimmune disorders, ganyan. So, very wide range talaga of mga subspecialties under derm also.
Okay.
Pediaderm, meron ding pediaderm. So, mga pediatric dermatologists. A lot of mga congenital skin conditions, ganyan, mga congenital tumors.
Is every skin different? No? So, pinag-uusapan natin kanina na Western skin is different from Asian skin.
Yes.
Totoo ba?
Yes, so definitely kasi, if you'll notice, for example, bakit nga ba in Australia, super daming magagandang types of sunscreen versus dito sa Philippines? Kasi in Australia, they have really high rates of skin cancers there. You'll notice, makikita mo naman sa type ng balat natin versus Caucasians. We have darker skin types than most, Caucasian countries. The reason being, we have greater melanin pigments present in our skin versus them. So, that's also partly the reason why mas mataas din yung rates of skin cancer in their skin types. Kasi it's the melanin in our skin that actually protects us from the harmful UV rays. For them, compounded with their practices na, di ba, in these Western countries, they usually do tanning beds, ganyan, nagbibilad sila sa Bondi Beach, ganyan. All of these Western practices, they want the tan, they want that summer glow, ganyan. Yun din yung nagiging reason bakit mas mataas yung rates of skin cancer sa kanila versus sa atin. It's the accumulated sun damage.
So it's the weather, no? Iba yung weather
Iba yung
ng
weather,
sa Australia. And I'm assuming pati yung genes ng tao.
Yeah,
diba?
may genetic
Iba-iba.
predispositions also definitely. So, maliban doon nga, parang, yun nga, yung activities din nila, di ba, mahilig din sila sa, for example, water sports, ganyan. Though dito, meron din certain areas, kasi nga, archipelago din tayo, yung nagpo-protect talaga sa atin is the pigmentation in our skin. But, word of caution also, especially for our viewers, no? Like, it doesn't mean that kahit na may kayo manggi tayo, it doesn't mean na hindi tayo dapat maglagay ng sunscreen. There's really that important step that you need to carry on or carry over every day.
I wanna go deeper to that question, Doc, no? So, kahit sa Asia, Korean skin, for example, and Filipino skin is also different.
Yes, well, apart from the obvious, no, if you take a look at us, we look very different from our Korean counterparts, our Japanese counterparts, even if they're within Asia also. So, it's good that you asked about that kasi ngayon, di ba, nauuso yung mga K-pop idols, mga K-dramas. During the height of the pandemic, when Crash Landing was very sikat, no, na series, everyone got into yung 10-step skincare routine. Kasi nga, syempre yun yung mga nauuso sa kanila. So, dahil maraming time yung mga tao sa bahay yung time ng pandemic, they really got into that, okay, let's do, cleansing, exfoliating, and then may serums na tatlong different kinds, and merong mga, essences and oils, ganyan. But you have to remember kasi, super different din naman yung weather sa Pilipinas versus in Korea. And they also change their skincare products depending on the season. So whatever works for you during the summer season might not work during winter because the weather is much drier, diba? It's cold, you get a lot of mga cracking and fissuring on the skin. Versus in the warm seasons or the warmer months, you'll need lighter formulation. So during that time nga, the point I wanted to drive at was during this time of the pandemic na maraming nagpapahid na compounded lahat ng mga products. Usually kasi these products will have or contain some sort of active ingredient. Whether it's brightening, anti-aging, anti-acne. In itself, siguro if you're gonna try out the product, one product at a time, you'll feel a little bit of yung active effect niya. Yung, kunwari, may konting drying kasi nga anti-acne. So, gusto mo medyo oil control, di ba? The problem with doing that 10-step skincare routine is once mag-react yung skin mo, you're unable to determine or distinguish which particular product you really reacted to, or is it like a compounded reaction ba from all the actives that you applied on your skin. Hindi na nila ma-identify. So, that's the importance of consulting also with your board-certified dermatologists because you're able to ask first, identify what your skin type really is.
So I think yun din yung problem talaga. Nilalump lahat ng Asian skin, Asian products into one. So talagang iba dapat yung skin routine or skin products for Korean. And baka iba rin dapat yung skin routine and skin products for Filipinos. So I think the problem in general about skincare and acne, especially here in the Philippines, and for guys, is that ang hirap siyang pag-usapan, ang hirap siyang in-open up without sounding rude.
Okay.
So, buti na lang, right now for the viewers, nandito si Doc, that would help solve or answer some of the questions we have here.
Okay. Actually, I think it might be a misconception that it only happens to guys, no? In Filipino culture kasi traditionally, we're always, hypercritical of each other. So, you get a lot of these comments, especially in family gatherings na unwarranted. Like, it's not welcome, but it's there.
Yung mga
tito na parang, uy, parang, taba mo na ngayon. Or like, ang itim mo ngayon, or ba't ganyan yung mukha mo ngayon, bako-bako, ganun. Maraming mga ganong comments usually, di ba? I mean, it happens. So, for that, I guess kaya nagkakaroon din ng a little bit of difficulty in opening up to your peers or to your family members about these types of concerns. But the great thing about this generation that we have now is we're a bit more open to discussing these things. And of course, if you're too shy or it's not very comfortable for you to tell your family members or to discuss these types of issues with your family members, that's what we're here for. So it would be best for you to discuss with a board-certified dermatologist or a specialist who can actually get to the root of the matter and not just, criticize how you look. Parang napag-usapan nyo nga, ganito yung skin ko ngayon, pero they're not really sure din naman what to tell you. So might as well, diba, you open it up na to a dermatologist who can actually help you with that problem and address how you feel about it. Because, it's something that you're in the back of your mind, usually, you're already aware that you have acne or you have oily skin. But no one needs to point it out for you. Diba? Aware ka na eh. Hindi mo lang siya nagiging concern before kasi parang, okay, oily, ganyan. But if, for example, lagi na may nagsasabi sa'yo, parang it would be better na at least kausapin mo na lang yung dermatologist mo para sabihin sa'yo, bakit nga ba siya oily? How to control it? How do we prevent the acne from developing if you have oily skin? Ganyan. At least, di lang ikaw nakipag-chikahan, di ba? May naging solusyon dun sa chikahan ninyo.
We have this question from David.
Okay.
How to properly cleanse your face?
Okay. So, I'm glad you asked about that question because it's really the most basic step in a skincare routine. The proper way to go about it, of course, would be first to identify your particular skin type. So, as I mentioned before, usually kasi patients would identify or think that they have, for example, oily skin kasi ako. But in truth pala, they wash their faces 3 times a day. So, ang nangyayari sa skin, parang nagkakaroon ng rebound oiliness because it's super strip dry of your oils, of your natural oils. Kaya sobrang nagiging oily ka. But in general, if you left it alone and followed the usual routine na twice a day max, di naman pala excessively oily. Or yun nga, may mga ibang patients who come in here and say, Doc, I actually have sensitive skin because I tried this product and it turned me red. So, madali ako mag-react. But if you look at the actual ingredients of these products, some of them will contain, say, glycolic acid, which is an alpha-hydroxy acid, an exfoliant. So, meron talagang drying effect. And then, yung iba, mag-retinol serums, ganyan. Hindi naman nila alam, retinol serum is also drying. Tapos talagang kinapala nila kasi anti-aging daw. So, they're very aggressive about applying it. So, I think before you even start with any, when you start building your skincare routine, it's best talaga to invest in that initial consult. Para at least you identify what particular skin type you have, mag-guide ka dun sa products that you need to purchase or the types of products that you can actually kind of invest in.
Dumadami na rin ba yung mga lalaki na nagpapa-derma?
Oh, yeah.
Concern?
Yes. So, hindi lang siya, ngayon, it's not a gender thing anymore. I like that now nga, in our generation now, feeling, kasama tayo dun. Talagang mas open na yung mga ganitong types of conversations. Before kasi, di ba, parang may gender stereotypes eh.
Yung mga guys.
Pag lalaki, skincare, ano mga kaartehan yan, di ba? Gugulong ka lang naman sa putikan din, ganon. Pero hindi na kasi ganon ngayon. So talagang, it's more of skin health. Di lang siya just aesthetics, it's skin health. So it's a new era of health and wellness in general.
Okay.
We include the skin already in that process.
Mas marami na yung guys na rin na nagiging mas conscious. Gusto nga nila na hindi rin nag-age yung skin nila.
Yeah.
And all that.
Kasi traditionally, di ba, it's very masked to think na pag lalaki, dapat, brusko yung itsura mo. Marami kang linya kasi you're hardworking. Pero I'm sure ikaw, hardworking ka. Wala masyadong linya. Ibig sabihin, nag-aalaga din. So, alam mo yun, mas accepting na ngayon.
Sabi mo nga, Doc, part tayo na younger generation.
Diba?
Conscious na tayo.
Part na tayo, diba? Mas ikaw nga, nagsa-sunscreen o nag-moisturizer. That wasn't the thing before, diba? Parang before tubig lang. Or at most, toner, diba? Nauso yung mga toner na pang lalaki before, after cleansing, kasi nga, they tend to be oily. Pero ngayon, we also get a lot of mga men who consult us for not just rashes, not just talagang skincare.
You mentioned that men's skin tends to be oily. So, iba ba yung men's skin sa female skin?
Yes, definitely. Kasi there's also hormonal factors that affect your skin type eh. So, usually, because nga of testosterone, there's higher levels of testosterone in males. It also induces or influences the oil production in your skin. Kaya magkaiba talaga. Yung products meant for men are a bit more drying than those that are for women.
I see. Okay, so you mentioned hormones and all that. So does it mean through age, matanda tayo, nag-iiba rin yung skin natin?
Yes.
Yung hormones natin nagbabago, di ba? So,
correct. I don't know if you're familiar with the practice na, di ba sa Pilipinas, mahilig tayo maghilod. Yung mga nag-lufa, scrubs, ganyan.
Okay.
Iba nga yung mga lola natin, mga buhay na bato, ganyan. Nagagamit nilang ganun. Usually kasi, ang napapansin namin, over time, mas nagiging intolerant na yung skin nila. So if that practice used to work for them when they were younger, nung kadalagahan nila, naghilod sila naman problem kasi feeling nila, hindi malinis yung skin kapag hindi ka naghilod. Over time, nagiging problem, mas nagda-dry out na yung skin eh. Kasi yung skin barrier natin, hindi siya kasing cohesive as we grow older. So, it's easier for moisture to actually evaporate and get out from our skin than when we were younger. So, all of these practices cause more irritation later on in life. You'll get a lot of mga, what we call serotic eczema, which is eczematous eruptions on the skin, mga rashes na from dryness. So, karamihan, yung mga naglulufa, like on the legs, on the arms, they get these mga rashes na makating-makati kasi sobrang tuyo.
I see.
So, hindi naman din uso natin yung lotion, di ba? So, mag-scrub sila, lufa-lufa, pero wala man lotion after. Kasi na malagkit.
So, nag-dry lang talaga
So, nagda-dry.
sila.
Kasi nga, over time, habang tumatanda, hindi na kasing ganda yung skin barrier. Hindi na niya kinakaya yung extra exfoliation.
So, basically, depending on your skin age, then kailangan iba rin yung skin routine mo.
Yes. Tsaka hindi talaga necessary yung scrubbing na yun. Yung physical scrubbing na vigorous.
Yung may bato na,
Yeah, oo.
parang pinapatay mo nga yung skin mo, di ba?
Yeah, parang ano yan eh. It's okay if, for example, visibly soiled ka. Mare, nag-Ironman ka, ganyan.
Okay.
Or nag-gardening ka. Sige, mag-scrub or ganyan. But you don't have to do it every day. You can do it once a week. Depende rin kasi on your activities, your skin type, ganyan. We exfoliate naman without us pushing our skin. Like, it's a natural process.
So, it's a natural process and kailangan din siya ng balat ng skin.
Yeah, yeah.
Pero,
So, nangyayari siya. May skin cycle kasi tayo. So, yung skin natin usually nagpapalit yan every 21 to 28 days. And if over time, when we grow older, as we mature, our skin kind of slows down. So, kaya siya nagkakaroon ng mas rough texture, ganyan.
Okay.
Mas nagiging blotchy yung skin, nagkakaroon ng fine lines. Kasi bumabagal yung process na yun. Versus, kunwari, if yung babies or yung mga bata, nasugatan sila, di ba hindi masyado nagsascar? Like, yung pangingitim, it goes away faster. Kaya rin hindi kami nag-whitening for kids masyado. Kasi, usually naman, it will, you have to run its own course.
Yung
Let
skin
it run.
cycle nila mas mabilis.
Faster pa.
So, the exfoliating helps make it accelerate the process.
Yeah. Kasi our skin naturally clears it out naman. So, it really depends on a lot of things. It's very tricky to say na, again, hindi siya one size fits all.
Yep.
Best pa rin to consult, syempre.
Okay. Sige. So, we have another question from Erica. How to get rid of pores?
That's the thing, no? With pores kasi, you don't want to get rid of it. Kasi you want to lang to minimize the appearance, but they're normal. You need the pores because they are where your sweat comes out of, they're where your oil production comes out of, ganyan. With pore size in general, number one pa rin to take care of it or to help minimize the effect would be to use sunscreen regularly. Pumapasok pa rin si sunscreen. Kasi what most people don't know is yung solar elastosis, yung sun damage dun sa pore openings, that will also contribute to the enlarged pore appearance. Nagiging lax yung whatever holds the pore together. Apart from that, no to excessive scrubbing, ganyan, or pricking. You know how we usually overdo itong mga pore strip, ganyan.
Okay. Yung parang mga strips.
Yeah, kasi it damages. I mean, it helps, but if you use it so regularly and over-aggressively, nadadamage din the collagen bundles and elastin bundles that hold the pores together. Apart from that, of course, we usually say or include retinoids in our routine whenever we prescribe to patients a particular anti-aging routine. But with topical, syempre, kailangan mo ng a bit of time for it to kick in. No? You won't see the effects immediately after just one tube, 2 tubes of the product. You have to use it consistently for you to be able to see the maximum effect. Personally, for me, if a patient is really concerned about their pore size, one, you'll have to address whether they have oily skin ba. Because usually for oily skin types, they have larger pores or larger pore appearance than those with normal skin types. And if they're really concerned about it, it's really best to go through, apart from the topicals, procedural-based treatments tayo. So, clinic-based approach, either through microneedling, laser treatments. Those are the ones talaga that will help you see the effects. Hindi naman immediately, but faster than with just topicals alone.
Okay. So it's again understanding what is your skin. So going back to having a good consultation, no?
Yes.
For example, in terms of weight,
Mhm.
parang pwede mong check yung bigat mo, di ba?
Yeah.
Yung fitness mo to your weight.
Yeah.
In terms of skin, is there a metric that we can monitor?
There's actually software available for doing that, no? So, if you go to some clinics, they will have that skin analysis machine.
Ay, parang may face.
Yeah, where you put your face in the machine and then they'll see how much pigment you have on this side, saan banda yung medyo and may enlarged pore appearance. There are different brands kasi available in the market and they have each different machine has a different feature that will highlight particular characteristics of your skin. So kung mas marami kang wrinkles on certain parts of your face or if for example you have redness on certain areas of the face, yan. So, some clinics will invest in that para nga you can compare objectively if each treatment ba has an effect. And then you can see also if your skin age matches your actual age. Yan. So, parang ikaw, sir, parang baby face tayo ngayon. Ano ba mga ginagamit nyo?
Wala, normal lang ang face wash, sunblock, moisturizer.
Okay.
Basic routine lang.
Yun naman actually. I mean, parang you can't go wrong with that. It's what I usually tell my patients nga, pinaka-basic would be to cleanse, moisturize, and protect. So you have it all pat down at least. Mukhang it works naman for him.
Thanks, Doc. So going back to the metric, no? So hindi siya, if a normal person walang equipment, how do they do that? Wala talagang way. So they have to like consult talaga Derma. That's the best alternative na.
Well, definitely, good clinical photos naman will already show you the difference, no? So, for example, if you really just want to observe whether a treatment is working for you or not, you can take good photos with proper lighting.
Okay.
Dapat same angles, same distance from the camera. Walang weird selfies.
And you can send that to the Derma already.
Yeah. So that's how we actually survived the pandemic as dermatologists. You know, we were the ones who were able to adapt faster than all other subspecialties. I guess because nga of that feature. You know, dermatology is very visual in nature. So for as long as we're able to see good quality photos, proper lighting, proper angles, we're able to compare din kasi if a patient is improving or the lesions ba are progressing, ganyan.
So, very clear na rin yung mga phone cameras ngayon as long as very good yung lighting.
You just also have to give your patients kasi the proper instructions on how to take the photos because there were times in the pandemic na parang, okay, weird selfies or like, may lesion na parang andito. So, hindi mo alam saang parte na ng katawan nila pinicturan, ganyan. Hirap din syempre ma-identify. So, personally, ako, preferred ko talaga face-to-face. But, syempre, you have to understand in time that we were all constrained. We can't really see each other face-to-face. All outpatient visits were canceled during that time. But, it's very fortunate nga that dermatology was able to adapt quickly to that demand.
Pero nag-bounce back na ngayon, no? Was it now better post-COVID?
Yeah, actually, it's gotten a lot better over the past year, I would say, in terms of dermatology visits. Siyempre, over 2022, 2023, nauna na yung ibang subspecialties who are, of course, mas emergent in nature. But in terms of dermatology now, bumabalik na tayo dun sa demand also for mga aesthetic procedures, ganyan.
Actually, interesting sa Philippines. I think sa Philippines in general, prioritize looks.
I think yung part ng culture natin, very critical tayo of each other eh. Which is, parang feeling ko may pros and cons naman. You always want to present yourself in the best way, diba? Like, it will help you build yourself na, okay, I have to look a certain way. I have to look good for me to approach this person, ganyan. But, at the same time, individually, some patients can be overcritical of themselves. So, you just have to find the right balance na you love yourself also. Diba? Parang yun yung God-given looks mo eh. Hindi ka naman pangit, hindi ka naman maitim, ganyan. Or kahit maitim ka, maganda pa rin ikaw. Hindi naman tayo dapat lahat maputi. Diba? Hindi naman maganda rin yung sobrang puti. Or alam mo yun, parang lahat tayo may kanya-kanyang opinion about that. It's just that you have to be comfortable in the skin that you're in. Kadalasan, no, yung patients will come to you, concern nila skin color.
Okay.
Gusto nila pa-whiten lahat. Pero, mapapansin mo, may iba silang pathologies. Like, gusto nila maputi, but they have active acne. Ganyan. Siyempre, unahin mo na muna yung talagang may, talagang pathologic. May problem na kailangan i-address before the whitening. So, minsan kailangan mo rin talaga i-guide na, okay, I think this is going to work well, but kailangan din natin i-prioritize yung skin health mo over whatever you feel is more, needed by you. Pero yun nga, parang iba rin kasi yung pressure to look a certain way in our culture.
So, ganun na pala to. I-guide yung mga nagko-consult sa'yo. Minsan na, hindi yan the best for you. Kung minsan, tingin mo, hindi suited sa kanila yung mga procedures na gusto nila and all that.
Parang syempre, you have to meet halfway. You always discuss with your patients upfront. Like, I understand this is what your concern is, but I think this might be better for you. Parang, is this okay with you if you want to try this out first? Ganyan. Parang you don't overpush naman na, ito dapat kasi hindi nga yan. Di ba? Parang, you have to respect also what your patients' wants are. But at the same time, we have to also kind of timpla yung pagiging authority mo sa dermatology sa kanila.
Interesting. So, next question is from Joanna. Is it okay to double cleanse every day?
Okay. So, with double cleansing kasi, that practice is usually done kapag, or personally, in my practice, I would tell my patients that they can double cleanse if, for example, they're wearing makeup, like, for example, heavy makeup, or they were outdoors for a prolonged period of time, like, kunwari, commuter, and you have all of these, singaw ng EDSA on your face.
So,
or talagang sports.
Kailangan.
Hindi naman absolutely kailangan, pero depende rin kasi on your activity eh. Parang kung saglit lang naman yung, mo, basta may visible, parang hindi man soiled, pero visible na na-expose ka sa elements of the environment, yan. Naipon yung dirt on your face. Basically, that step will help get rid of that additional layer of grime from the face. Kasi yung double cleansing, ang ginagawa niyan, before you cleanse with a soap-based or with a water-based cleanser, parang you allow the skin first to go through a process of removing it using an oil-based cleanser. Whether it be through micellar water or a balm, ganyan, or a cleansing oil. The purpose of that is for you to remove the additional layer of yung oil-based product that you use. For example, di ba, nag-liquid foundation yung mga girls. So, you want na mag-melt off that additional layer ng oil-based product before it gets removed with the water-based cleanser.
I see.
So, if, for example, dry skin or sensitive skin type, mag-double cleanse every day. Syempre, too aggressive yun. So, mas magiging prone siya to irritation, redness, itching. So, not all naman and not all the time.
Okay. Very interesting. Ngayon ko lang nalaman yun na pati rin pala yung pollutants, yung smog, and whatever. Kailangan mo rin pala siya i-cleanse.
Kung super sweaty ka, I mean, hindi naman kasi tayo malamig sa Pilipinas. We're unlike, di ba, super humid sa atin. So, alam mo nang magko-compound lahat yan over, throughout the day. And then, you also have, syempre, compounded by the fact na karamihan sa atin naka-mask pa ngayon. I mean, COVID's still around. It never really went away, di ba? It's still around. So, we're still wearing that masks. Certain jobs will entail or require you to wear a bit of makeup or, something on your face. So, you really have to do that extra step to get rid of the additional layer around this area of the face.
Parang napansin ko, pag yung naka-mask, parang mas marami acne.
Yeah. We call that acne mechanica. Kasi yung trauma, yung mismong friction of the mask sa skin induces the inflammatory process.
So we have a question from Pat. How often should I reapply sunscreen?
Okay. So, the usual interval that we say to our patients is between 2 to 4 hours, depending again on your activity. For example, if you're at the beach, if you have a certain sport that requires you, or you get to sweat a lot, syempre the frequency will also change, no? So, maganda ngayon, marami ng iba-ibang types of sunscreen reapplication processes. Like, hindi na siya like before na it's just that lotion form na ipapahid mo, tapos puting-puti yung mukha mo.
Pero may white cast.
May white cast,
Ah.
yeah. So, hindi na siya ganun ngayon. So, ngayon, marami na ibang ways. Pwede nang through makeup infused with SPF. Meron tayong sunscreen sticks. Meron tayong mga sunscreen sprays. Marami na iba-ibang products that have that additional sunscreen protection.
And from what I know, there's types nga ng sunscreen, like mineral versus chemical
Yeah.
sunscreen. Are they both good or?
Yeah, both are good naman. So there's pros and cons to each subtype. With mineral sunscreens kasi, these are usually what contains titanium dioxides or zinc oxides.
Okay.
These are your mineral filters. So you think about it as para siyang mirrors on your skin. So when you apply it, the harmful UV rays bounces off from the surface of the skin. So, mineral sunscreen is better for sensitive skin types because hindi sila as irritating. But the problem with it lang is it's not as cosmetically pleasing, no? Because nga of that, yung white cast. So, nalaman mo sa Baywatch dati.
Makapal, mainit.
Yeah. Yung sa Baywatch, yung puti yung ilong na ganun. Yun yung traditional na mineral sunscreen. But, ngayon kasi with newer formulations, they have mga micronized na mineral filters that make it more cosmetically acceptable. And then, you have your chemical filters naman na instead of bouncing off the UV, yung harmful UV rays, they absorb it and allow it not to, penetrate deeper into the skin. So, yun yung mga may avobenzone, oxybenzone, ganyan. Magtinignan mo yung mga sunblocks, yung mga own. Yun. But, the great thing naman about chemical sunscreens is mas cosmetically pleasing. Sila yung parang primer yung feeling, ganon, parang makeup.
Mas light yung skin,
yeah.
no?
So,
chemical.
Yung iba namang sunscreen brands ngayon, they combine both. Kasi nga, merong benefits to both mineral and chemical sunscreen. So, marami na rin mga ibang formulations nowadays.
How about yung mga SPF? SPF 10, 20, 35, 50. May pa yata 80 eh.
Yeah, may 100 pa. So, traditionally, what we usually recommend at the very least would be an SPF of 30. But the problem lang kasi with that is you assume, there are certain caveats, no? You assume that at yung SPF 30 na sunscreen, you apply it in the proper amount. You apply it in the proper interval. So, it takes about 15 minutes for your skin to absorb the sunscreen. Okay. So, you have to apply it before your activity or before you go out. Hindi yung patalon ka na sa pool, tsaka ka nagsispray. Or saka ka nagpapahid, diba?
Mapa-absorb mo pa.
Yeah. So, you allow it to set first before you jump. And then, or before you go out of the house. And then, usually pa, ang pahid ng sunscreen sa Pilipinas, hindi cute lang. Parang, ayoko mamuti yung face ko, ganun. Hindi. Dapat enough to cover the entire face. So, meron kaming actual amount na binibigay dyan. Kadalasan yung isang shot glass full to cover the entire body.
For the body?
Yeah. Or kunwari, for the face, meron kaming ibang ina-advocate na parang yung 2-finger rule. Yung parang, your 2 fingers, these should cover the entire face already. So,
how does that work? 2 fingers?
If you apply, for example, the sunscreen on your 2 fingers,
okay.
that should cover, that amount should cover the entire face.
Walang specific, weight or...
Wala naman, because that's what we call the fingertip units. Yeah.
Okay.
Pero syempre, may more or less, gauge lang naman siya. Hindi siya actual na, okay, yun yung dapat number. Gauge siya. Para lang may guide tayo. Kasi, minsan pa dot-dot. Cute lang mag-apply mga Pilipino kasi nga ayaw manlagkit, di ba? Hindi nga enough yun to afford the 97% protection ng SPF 30. So, to give you an idea, yung SPF 50, which is about 20, di ba, points above 30, that will only afford you 98%. So, konti lang yung margin of difference. But yun nga, kaya nga at least SPF 30 with the proper application, proper amount, proper intervals. And then, you also check if your sunscreens have, kung broad spectrum ba siya, if it covers for both UVA and UVB.
I see. Okay.
If it covers for now, may mga sunscreen that have visible light filters, blue light filters, yung mga kapag lagi tayo nasa gadgets, di ba? Iba pa yung light doon.
Does that work? Yung mga blue light filters and all that?
Yeah, there's some merit to that. Especially depending on your job, di ba? So there are some of us that are really based sa gadget yung trabaho. Kung lagi ka nag-edit, ganyan. So, pwede rin yun. You have to look into that. Also, infrared light, ganyan.
Since we're talking about sunscreen already, may mga misconceptions natin yung sunscreen. Like, kailangan mo ba mag-sunscreen pag cloudy yung weather, maulan, pag nasa
Yes.
bahay ka lang?
Yes, kailangan pa din. Only because even our mga fluorescent light bulbs, all of these will still limit UV radiation. So even if you're indoors, even if it's cloudy, when it's cloudy, the sun rays still penetrate to the windows. So it's a misconception that you don't need to apply it pag umulan.
Okay.
But there are other, kasi nga, ang init sa Philippines. So, there are other options. You can invest also in UV protective gear, like mga long sleeve clothing na may UPF or wide-brimmed hats, yung mga sunglasses, ganyan. There are other things also that you can try to use to help protect you better.
Okay. Pero I'm curious. So, since pag-usapan kanina, mayroon akong 2-month-old baby, but pinapaaraw sila ng mga 6 a.m. to 8 a.m. Diba? There's a reason for bakit natin pinapaaraw yung kids.
So, it's usually because the peak UV rays ng ating sun ay from 10 to 2, yung harmful UV rays. So, you have to, yung UV radiation kasi na natatanggap ng babies natin within that period, it helps them with their, diba, yung sa bile. Yung para ma-prevent yung pagdidilaw ng bata. Or to help, the jaundice, sorry. Trying to talk late, my layman's terms. Yan, so parang hindi sila mag-jaundice. Yung jaundice ng newborn, usually, after 10 a.m. kasi, yun yung nagkikick in na yung talagang katirikan ng araw. So we really highly advise against exposing yourselves during that period. So even pag nasa beach, diba, parang i-rest mo muna yung go in the shade for that period, tapos mag-afternoon ka na lang uli, nababad, gano'n.
So unhealthy kahit na may sunblock ka, you should still avoid 10 p.m. to 2
10 a.m. to 2 p.m. Yeah. Ideally. Or at least man lang minimize your exposure during that period. Huwag ka lang magbaba. Yung tipong iba nag-sunbathing ng tanghaling tapat, huwag naman gano'n.
Kasi Western culture yan.
Yeah.
10 a.m. to 2 p.m. Talagang babad sila.
Yeah. Hindi sila masyadong very conscious about it. But I think now, they are na. Kasi nga, mas meron na ring education about sun protection in general.
We have a question from Bianca. Is there an overnight treatment for pimples?
So, with overnight treatments, syempre, it's different when you have talagang acne breakouts all over your face. You won't expect that to heal overnight. But we do get the occasional breakouts. Diba? Like, all of us being human, we get that. And it usually comes at the most opportune moments. Like, usually before an event, diba? Like, I remember, before I got married, the night before, may breakouts talaga ako on my chin. Because it was a stressful period, diba? Parang high-strung na yan bride, diba? So, I remember may baon akong solution for myself. I would ask help from people to inject me with a certain, solution to help get rid of the inflammatory process. Para the following day, medyo not as galit siya.
So like there are mix of ingredients.
Yeah, usually we mix intralesional solutions to help get rid of the redness, the inflammation, to help it die down faster. So better pa rin talaga, syempre, in clinic, no? We also sometimes combine lasers to particularly spot treat pimples. So, yun, yung combination of those two, if you want really a faster...
so, if you want like a one-day removal of acne...
I can't really promise, syempre, that it will happen in a day. Like, hindi siya nangyayari all the time. Depending also on the depth.
Okay.
Kasi merong iba super cystic, yung talagang malaking malalalim. Iba sometime naman, hindi na kami miracle workers, di ba? Parang, syempre, may tulong yon, pero it's not gonna get rid of it completely. But at least magbabawas yung thickening niya. And you can't always demand rin your doctors. I know this procedure is very popular or very common, especially sa mahilig mag-visit talaga sa derm. But, meron din kasi siyang side effects. So, we can't really offer it always at the same time. Because, a solution will also contain a particular ingredient that will help also, that has some side effect of atrophy, yung nagninipis yung skin. So, magkakaroon ng textural changes over time if you over-eagerly. Like, may patients kasi who jump from clinic to clinic to get this type of treatment because they're already familiar with it. So it's really best pa rin that you, after your initial breakouts, yung may mga pimple emergencies, you talk to your dermatologist naman. Hindi lang yung pupunta ka doon para magpa-inject. Para malaman namin why you're breaking out in the first place. How to prevent that from happening again.
Okay. Interesting. Different question is from Nika. What are your thoughts about skin purging?
Skin purging will happen or can happen but not in all patients. So this commonly occurs when we start patients on anti-acne regimens that will contain mga retinoids or other exfoliants. These products kasi will help increase or regulate the turnover of your skin. So if you have mga blackheads and whiteheads, your comedones, these are your precursors to inflammatory acne. Doon sila naglalabasan. So if the skin is trying to purge out all of these comedones from your skin, and in time, they will appear as inflammatory acne. But you'll know it's purging versus actual irritant reaction or a breakout if it only occurs on areas where you usually break out na. It's a different case and it usually openly happens within the first 4 to 6 weeks, more or less. If it's beyond that na or it goes beyond the usual areas of your breakouts, it might be an irritant reaction to something. So again, you have to follow up with your dermatologist.
I see.
You converse with your healthcare provider regarding all of these things, no? Kasi baka sabihin mo, yung binigay kasi ni doc hindi effective, lalo ako nagka-pimples. It could be part of the process. Sometimes it gets worse before it gets better, diba? So you have to be patient also with your acne regimens. It really takes a lot of consistency for you to be able to see good results.
I see. There's another question from Kim. How often should one get a facial treatment?
Okay. So with facial treatments naman, I think the general guide would be every 2 to 4 weeks. As a, parang, it depends. If you're treating something or if you're infusing actives into the facial routine, it might be better to do shorter intervals. Like for example, you're doing it for acne because you have active acne that the doctor is treating. It might be better to do it within every 2 weeks, for example. And then later on, when it gets better, then you can have it further apart, like monthly treatments na lang, ganyan. But there are also facials kasi na parang it's really more of a pamper day for the patient, ganyan. Wala naman talagang actual issues to be addressed, but they really want to feel, pampered. There are some facials naman that are not as intensive as the others, so you can still opt for that naman. But the usual dogma is about 2 to 4 weeks in between.
Okay. See. Another question from Tess. Is face slimming procedures, yung mga non-invasive, really effective?
As someone with a round face, there are a lot of different options that you can explore in terms of face slimming, no? So, hindi tayo lahat blessed with the hugis bigas, di ba? Parang yun yung aim ng karamihan ng, lalo na females. We do combination treatments definitely, whether it's toxin injections for the masseter. Masseter yung parang jaw muscles mo when you chew, di ba? Parang, if mahilig ka sa gum, for example, medyo lumalakas yung muscle mo dito.
Oh, it's kakapal yung
Kumakapal
jaw mo?
siya. Parang ka nag-workout, di ba? Pag
Ah,
nag-workout ka, you do repetitive movement, small repetitive movements to build the muscle. So when you chew gum, or when you chew a lot, yun yung nangyayari. Para siyang mini-workout mo yung jaw mo. So kaya siya lumalaki. Pero what we do is we target these muscles with neurotoxins or neuromodulators to help weaken that specifically. Hindi ka naman maglalaway from the procedures if done appropriately. It will help at least make the muscles smaller and sculpt the face. Apart from that, of course, we also have mga lipodissolving solutions, mga injectable solutions that will help break down the fat and help you, remove it faster from the body. And then we also have, because you will lose a bit of bulk from your face, whether from the mesolipo solutions or the toxin injections, there will be a little bit of skin laxity. So we also address that with energy-based devices,
Okay.
whether through radiofrequency treatments, HIFU treatments, mga ganyan.
Actually, marami pang questions nakabang, pero yung ubusin yung time mo with that. So maybe you can probably give us a summary of a skincare routine that the viewers can understand.
Okay. So to break it down simply, it's really just, if you want the bare minimum and you don't have a lot of time, it's just really simply cleansing, moisturizing, and protecting your skin. So you cleanse your skin with an appropriate cleanser, like one that is suitable for your skin type. So if you have dry skin, syempre a bit more moisturizing. Something with ceramide, something with hyaluronic acid, oatmeal, yan. For those with oily skin, you'd want something that's a bit more foaming, something that will contain alpha hydroxy acids or beta hydroxy acids, yung mga glycolic, salicylic base, ganyan. Then, if you have combination skin, usually titimplahin mo. Like, kung sa morning ba, iba yung product mo, sa gabi, iba. Pag sensitive skin type, something naman with soothing properties or anti-inflammatory properties should help na hindi rin masyadong fragrance. Walang fragrances, wala masyadong lathering. Yan yung mga gusto natin for sensitive skin. So, apart from that, in the morning, you'd want to use sun protection, of course, after. If you feel like your skin is already pretty oily, you can skip the moisturizer part kasi most sunscreens now, you can actually parang take the place of your moisturizer. Meron na silang moisturizing properties. And then, in the evening, if you have certain skin concerns, then you can add on other things, no? Like your retinoids, that's where it kicks in. Or your mga other exfoliants, pwede mo rin doon. Usually kasi in the morning, di ba, parang we have less time than in the evening kasi nagmamadali tayo to go to.
So, pwede ka
Ah,
relax.
kasi skincare yan
Skincare
ganyan.
routine.
Although, in the morning pala, if you have like pigmentation, okay rin to introduce yung mga vitamin C serums, niacinamides, ganyan. Okay lang yan in the morning. But better talaga in the evening, yung mga retinoids. Yeah.
Just to emphasize, it's cleansing, moisturizing, and protect.
Yes, and then the additional step is to treat.
To treat.
If there's anything,
If may skin
like if may
problems.
skin issues ka, may additional step of treating.
I see.
Yeah.
How about lifestyle? Mga basic lifestyle tips or routine na pwede natin gawin para maging mas okay yung skin.
Okay. Drinking an appropriate amount of water every day, keeping yourself hydrated, tanggalin mga bisyo sa katawan, especially yung mga yosi-yosi. Kasi, syempre, oxidants yan, no? Puro kang alagay na antioxidant sa skincare mo, tapos yosi ka naman, di ba? Parang, ano na sis? Tapos, yung balanced diet. So, you have to put your greens in. And also exercise because that will also help with your blood flow. And then, of course, yung managing of stress. So, stress kasi that's part of life, di ba? I mean, lahat naman tayo stressed out at some point. But you have to manage it appropriately.
Parang malaki rin talaga yung difference ng diet, no? So, I think challenge rin dito sa Philippines, yung Filipino diet.
Oh, yeah.
Puro oily,
Yeah.
puro salty.
Puro carbs.
Puro carbs.
Yeah.
So, baka it's a huge factor kung bakit yung skin mo hindi ganun ka ganda.
Malaki talagang factor na gagawa ng diet sa skin. So, even for example, yung mga may acne-prone skin, we usually tell them na, kadalasan kasi sinasabi ng mga grandparents, yung mga oily, no? Yung mga prito, huwag kang kumakain ng prito. Huwag kang kumain ng mani. Yun yung mga nagbabawal nila pag acne prone, di ba? Pero yung may actual evidence talaga would be your high glycemic index diets, yung mga sugary food,
Okay.
and also yung mga ma-dairy also.
So if there's something to avoid, sugar number one.
Yeah, sugars and certain types of dairy. Hindi all naman. So we don't ask the teenagers who have active breakouts to stop drinking milk. Syempre, it's during that time na talagang may growth spurt sila. You want to support their bone health. Huwag mo naman sila pigilan uminom ng gatas kasi may breakout sila. So, yun pa rin. Parang case-to-case basis pa rin usually.
You know, of course, lifestyle in terms of exercise, kailangan tuloy-tuloy. So, does that help ba? Yung parang sweat and all that? May involvement ba yun on better skin? Or
I would say yes because nga yung blood flow mo is better when you exercise. So, if you have any inflammatory things in your body can actually send the anti-inflammatory stuff better to those areas where you need it most. So, mas nakakapag-function siya regularly than your mga mas sedentary counterparts.
Okay. We have a few myths that we want to debunk na tinatanong ng team ko. So, hopefully matulungan mo kami.
Okay.
So, one is, totoo bang using toothpaste would get rid of pimples?
Okay. Actually, no. We highly advise against it. Kasi, what it does, okay, bakit nga ba siya ginagawa before?
Okay.
Usually kasi, pag yung mga toothpaste natin, di ba, meron niyang baking soda or some drying agent. Traditionally, yung mga earlier formulations will also have triclosan. So, at some point, it also helps dry it out. So, may drying properties. Kaya yung iba naglalagay ng toothpaste. But ngayon kasi, medyo nag-ban na sa triclosan eh. Parang meron siyang, basta hindi na siya as commonly introduced or incorporated into products. Apart from that, you still have yung mga baking soda, ganyan to help whiten the teeth. But it's quite irritating to skin. So, if you spot treat it on that area, there's a chance that you might get irritation from the surrounding normal skin. And then I guess may soothing property yung tingly feeling ng mint. But mint and anything mentholated is actually also a possible irritant. So, we highly advise against that.
So it might actually make it worse.
Yes. Baka nga, okay, medyo dry, pero puro ka naman irritation na dito sa surrounding area. Ganyan.
Okay, sige. So at least na-debunk na yung myth na yun. Another myth is, does rubbing calamansi on your dark spots help it? Or
Okay. So, growing up in a Filipino traditional family also, nagdaan rin yung mga kamag-anak ko na mga face na ganyan. Yung kung ano-ano yung nirarub nilang calamansi sa mga kilikili, singit, ganyan. Citric acid kasi is the active ingredient in these citrus fruits, diba? So, they have brightening properties because of the acid.
yeah.
But the problem with that kasi, it's also a potential irritant. Imagine these areas are very occluded, diba? Kilikili, singit, mga intertriginous areas. If nagka-concentrated amount of that type of acid, it can actually worsen the pigmentation.
So
It will help burn your skin. So, we wouldn't advise na you put calamansi. I mean, I'm sure there are a lot of mga household tales that would say na effective naman sa anak ko, pinagsasabi nito. Pero, hindi kasi siya pwedeng one-fits-all kind of thing. Per person, may mga patients na mas sensitive. Tapos, ikakalamansi mo yung kilikili nila. Di lalo nung nangitim dahil nag-burn.
I see.
Mga ganon. So, while there is some merit naman, kasi nga brightening yung citric acid, but hindi talaga siya advisable na ipagawa sa lahat. We've gotten patients na mas nag-darken or mas nag-thicken yung skin sa underarms because nga it was irritated from the calamansi.
Kasi may mga products rin na, for example, soap with calamansi. So, ganun din yung case.
With soaps kasi, okay lang naman. There will be some effect. Pero I think with soaps in general, yung contact time to the skin is important eh. For me, at least, if you think about it, if you use a certain product that gets washed off after, depending also on how you use it, yung, di ba, parang iba, sabon, bumula na, hugas na, banlaw na, parang binanlawan mo lang yung binayaran mo. Hindi siya ma-absorb ng skin kasi super short lang ng contact time. Unless na lang super potent na I don't think naman din maalaw ng FDA yung sobrang strong acid to be incorporated in an over-the-counter product, di ba? So yun yung mga caveats to these things.
Na-debunk din natin yung calamansi na myth, no?
Yes.
So just to summarize the learnings that I've got from Dr. Kate, one, that every skin type is different, no? So, iba siguro yung Korean skin, iba siguro yung Filipino skin, and in general, iba-iba yung skin ng tao. Two, that you have to, for a basic skincare routine, you have to protect, you have to moisturize, you have to cleanse, and you have to treat. And third, and finally, if talagang nagkakaproblema ka sa skin mo, the best is for you to really consult a board-certified dermatologist. Before we end, we have a segment that we have a question from our previous guest. So the question is, what is the most important value or what is the most important rule in your life that you want to share?
Okay. So, I think the value that I really put high up in my priority would be respect above all things. Whether it's someone you're senior, someone younger than you, someone wherein you're in a position of power, you always have to treat everyone with respect. First and foremost, you don't treat people differently just because you came from somewhere else or you're in a different stature in life.
No, I agree. By showing respect really shows who you are as
Yes.
a person.
It's very telling kasi if you don't treat people with respect.
I agree. So with that, you also need to have a question for my next guest.
Okay. Sige. My question would be, if you weren't doing what you're doing now? Like, if you're not in your current job, what would you have gone into instead?
Interesting question. Very exciting. Thank you for today, Dr. Kate. So, if you have any more questions, may nahihiya kayong tanong, please visit Dr. Kate. Nandito siya sa Sunday Skin Center at Santolan Town Plaza. And she is here 10 a.m. to 7 p.m. every day.
From opening to closing every day so far. So ngayon, in case naman you're here, no, don't be shy to drop by and say hi. I have a team of board-certified dermatologists and aesthetic specialists who can help assist you with any of your skincare and aesthetic concerns.
So, Doctor, anything that you want to plug? Facebook, Instagram?
Follow us at Sunday Skin Center on Instagram and also Sunday Skin on Facebook.
Okay. So, please follow and like and subscribe for the Zone and catch us in the next episode.
Thank you.